Kellogg-Spadt, and I'm here today to talk to you about dilators. So I don't know about you, but in training, I did not have a class called How to Use a Dilator, How to Teach a Patient How to Use a Dilator. But what I did have was instruction from textbooks and instructors saying, oh, don't forget that dilating can be a very, very important aspect of helping a person who has sexual pain. So I'm here to talk to you a little bit about how to use a dilator, what kind of dilators there are, what to choose from, and to introduce the new expanding dilator as well. So first of all, dilators come in all shapes and sizes. There's dilators that are made from silicone, voila. There's dilators that are made from hard plastic like this. There's little tiny dilators. There's gigantic dilators. There's curved dilators, everything your heart could desire. But maybe your heart doesn't desire any of them, or maybe your patients have used all of them and they have had it up to here. They're like, it's daunting, they're giant, I can't get from one size to the next. Just when I get my confidence built up, I can't get to the bigger one. So this problem existed in the marketplace, and the new Milli dilator is the first of its kind to address some of these very common issues with dilating. It looks like this, and the Milli dilator, as you can see, starts out really small, about the same size as my finger, but it has a digital readout on it, and as I expand it, you're going to see that it, in fact, is an expandable dilator. I'm pressing on the plus button right now, and it is displaying a number of digital readouts from 1 to 25. And as it does so, it very slowly and gently increases its size. Now, the tip of the dilator stays quite small, but the circumference here at the introitus, which is where most women need their maximum stretch, is actually getting bigger and bigger. This is a level 17 right now, and it gets all the way up to a 25. Now, what's really cool about this is that the patient can use the dilator. She's in control. She puts it in a very undaunting size, which is, again, the size of my finger, and then she can take it up in increments each day or every other day, or however often she uses it. It comes in a really discreet, rechargeable box. You notice it doesn't have any unusual veins or anything really upsetting on it. And if someone in the family were to find it, they wouldn't really know exactly what it was, but it clearly looks more like a medical device than a sex toy. And most patients actually like that because they feel like it's recommended by a clinician and it's for a medical purpose. Although in a minute, we'll talk about the fact that it can be used for recreational purposes as well. Again, what is different about Milli is that the woman herself is in control. Now imagine that you were using this size dilator and feeling very confident that you were just doing great, able to get it in. This is my little stuffed vagina, able to get it in quite easily. And then you really thought you were doing well when you got to this larger size and had to very slowly be able to get it in and take it out. But then imagine the feeling of overwhelm when you're on this size doing really well, and you find out that your partner is in fact this size, even bigger. Now, by anybody's standards, this is pretty big. And so jumping from this size to this size, which there's nothing in between, is what actually stops patients kind of dead in their tracks. And so the ability to go more slowly, more gently from a smaller size to a little bit bigger and a little bit bigger in 25 millimeter increments is what makes success happen with Milli. In addition, the Milli has a vibrating function. This can be set on high or low, and the vibration can be used in a number of instances. And it has been my clinical experience that this is a game changer, that people who come to me that have been on plateaus in their graduated dilator programs have broken through those plateaus using the Milli dilator.